Welcome everyone. We are Team 8 from the program Data Science for All Colombia in the 4th edition. We are Pedro, Nicolás, Sergio, Julián, Angie, and Diego. In this video, we will explore the factors affecting the prevalence and spread of influenza using data science. According to the World Health Organization, influenza is a virus that causes between 3 and 5 million cases of illness per year around the world. From these infected people, between 250,000 and 500,000 died because of this virus. Even though the more affected population are 65 years or older people, children and adults can also face complications. Collecting records of people infected with this virus since 2000 until 2015, we are going to use data science to analyze the behavior and spread of this virus around the world during these years. Dealing with data is always a challenging task. The data that we are using show a right skew distribution. That is why we needed to use a logarithmic transformation to make the data more like a normal shape. We can also see that the vast majority of influenza cases are concentrated around the year 2009. This is due to the newest strain of influenza that appeared in that year, the swine flu outbreak from 2009. There are several factors that might affect the spread and prevalence of influenza across the world. Our data show that the most relevant factors are related to health, sanitation, and hygiene. For example, the access to clean water. We see that Africa performed poorly in providing clean water to its population. Also, the access to sanitation and hand washing services. This is also a reason why in Africa the influenza and other viruses and diseases hits hard in that region. We can also see that the number of physicians or doctors available for the population affects the death rate of influenza, as people are not available to get proper treatment in hospitals and health centers. Our data science analysis also showed that tourism and travel habits have an impact on the number of cases of influenza. As we see in these pictures, we can observe that the number of cases becomes higher when the number of arrivals and departures between regions increases. So it is worthwhile to see the behavior and spreading of influenza across the regions. So if we look at the number of cases occurred during that time of period around the world, we can see that in North America, in the USA, the number of cases was way higher than any other region. We also need to take into account that the USA is a very populated country. So if we standardize our data by the number of cases over the population on each country, we see now that influenza hit harder in Europe. This is also a reason why traveling has an impact on influenza. As we know, in Europe, the transit between countries is very easy. The median of influenza cases across the regions is very similar, as well as its variability. However, the death rate is very different across the regions. In Africa, the death rate can be as high as 15%. On the other hand, regions in America and Europe, the death rate can be as low as 3%. This is due to also economic factors and access to hand washing facilities and government investment on health. As we can see, air quality, unemployment rate, the gross domestic product, and the number of available hospital beds across the region plays an important role on determining the death rate of influenza. We can see that the lower these factors are, the higher the death rate of influenza is going to be. There are more cases concentrated around regions with low factors. We can also use data science to see how each of these factors affects the mortality rate of influenza across the regions. For example, we found that regions with immunization rate lower than 64%, with 4 physicians available per 10,000 people, and with low sanitation services, have a mortality rate of about 10%. On the other hand, countries that have immunization rate higher than 64% have more available hospital beds and physicians available for its population, have a mortality rate of about 0.95%. This study is a shout out to governments to invest more money on health services, on training more physicians, and taking care of the air quality, access to water services, and sanitation facilities. To summarize, we used data science to find those factors that affect the most the spread of this contagious disease.